IOSH convened this meeting at the Institute of Directors today to discuss the role of the mental health first aider in the workplace and what kind of support is necessary for that individual to have best effect.
This has been a really useful day today because we had the opportunity really to test out our results with people who are in the market and to see what they thought about it, and also been a real opportunity to meet people who are really in charge of promoting these strategies in their own workplaces. Really to touch base with them about the kind of issues that they have and to talk really from the point of view of our research about what we think they can learn from what we have done.
The roundtable that IOSH convened today I found really useful. We were talking about, the research that's happened around mental health first aid and the effectiveness of that in the workplace, but it was a really rich discussion which always highlights the complexity of this issue and the fact that employers need to think about the whole piece, and mental health first aid is one part of that. And it's about, all of your hardcore policies that support the well-being of your staff, but then it's all the stuff around people management and performance management, and then it's all the stuff around your culture, so it cuts across so much.
I think the conversation that IOSH has brought together today is extremely important in terms of us understanding the role of the practitioner and how IOSH can play a key part in making sure all the professional body, that's 46,000 health and safety professionals, and the wider managers that rely on our guidance to make sure they get the right access to the right information to allow them to get that right level of understanding and put it into their organisations and support the world of work better around mental health.
That this really is an organisational approach. It's not enough just to have someone who's really committed to this in their own little department. You have to have a whole systems approach. So it's top down, it's bottom up. You need this to be embraced by the organisation. You really need to make sure that people know what's going on. You need sign up, and you need monitoring of effectively what sort of interventions are being conducted in the workplace.
There was no major surprises for us today. I think we were very pleased with the results. The discussions were very fruitful, and there's a lot of learning that we can take away from today.
While mental health first aid is very much prominent in the media at the moment, there is still a room for much more in terms of research so that we understand how mental health first aid can affect things positively within the workplace.
I'd like to thank IOSH for their invitation today to the round table. It's been a very fruitful discussion.
IOSH can use these results for its membership. I think that we've come up with some really practical suggestions about how we can improve this intervention in the workplace, and I'm hoping that organisations will just take these forward.